Hi, I'm Dr. Ron Kurzeka, author of The Total Parent, and today's topic is bleeding, and bleeding from various areas such as nosebleeds, rectal bleeding, etc. So let's talk about nosebleeds first. First, the key thing to keep in mind with a nosebleed is you want to put pressure on the bleeding area. One of the common mistakes I see parents doing is they will put a piece of paper or hold something under the nose. The key thing that you want to do is put pressure on both sides of the nose and squeeze the nose on both sides to cause pressure, and that will usually stop the bleeding in many cases. But don't put an ice pack or your hand under the nose because that's really not going to stop the bleeding. If your child is bleeding from any other areas, such as from the rectum or in the urine, there's different things that should be checked out. Any rectal bleeding, of course, should be evaluated by your doctor as soon as possible, especially if the child has a significant amount. Significant amount being more than a teaspoon or so. Bleeding from the urine can be caused by a urinary infection if it's pink urine where there's just a little bit of blood in the urine. But if it's more significant bleeding, then the child should be seen by your doctor as soon as possible. Bleeding from other areas such as the ear, maybe due to trauma, such as a child may be picking at their ear with a Q-tip or something and causing the external ear canal to bleed. Any external bleeding, however, such as bleeding from a cut area on the skin, should be controlled with pressure on the bleeding area. So if you take a piece of gauze and just put it over the cut and apply direct pressure for about 5 to 10 minutes, that will frequently slow down or control the bleeding. So keep in mind the tips for bleeding. Keep in mind how to stop a nosebleed by applying pressure on both sides of the nose. If you have a child who has a bleeding cut, apply pressure directly to the wound. If they have bleeding from the rectum, they should be seen by your doctor the same day. Or if they have bleeding from the penis or the urethra, they should be seen by your doctor also. Thank you for watching. My name is Dr. Ron Kurzeka.